Good evening, everyone, and welcome to Atp Live Monday. How has your day been? I am Gbemisola Boyede, and it's my pleasure to be here for this fresh episode of ATP Live Monday. All right. Um, okay. So welcome, whichever platform you're joining in on Facebook. I hope you can hear me. And let me increase my volume. All right, welcome to ATP Live Monday. This is a program brought to you by Ask the Pediatricians Foundation. It's a program where you get to ask any questions that you may have about the health of your children, and we'll try and answer them in the next 1 hour. So, thank you so much for joining me. So, before we start, I'm going to crave your indulgence to try and share the video. Um, Share it to everybody so that they can see and they can hear us. I'm going to do the same as well. But if you have any questions, you are free to start to answer your question. To start putting your questions in comment section on Facebook, on YouTube, on Instagram, whichever platform you're watching on now. But let's also share the video and invite our friends and family to be part of this ATP Live Monday. I'm just trying to share now to our groups on Facebook so that they can see, because we stream from the page. We don't stream directly to the group anymore from due to Facebook policy. But I need to share it. So if you are watching from the groups, please remember that you have to click on the video and drop your comment directly under the video, or else I will struggle to see your questions, because I do see sometimes people just drop the questions in the link shared to the group, but we won't be able to see that. But if you click on the video itself and then drop your questions under the video, and then I will be able to see it and I'll be able to answer it. So thank you so much for joining me. I'm still just sharing the video for now. Um, just couple more minutes and then I'll be done. But welcome everyone. If you have any questions about the health of your children, feel free to ask the questions now and then we'll answer them. Also sharing to okay, now let me go and pin them in the groups. I think I've done the sharing, then just the pinning. All right, so welcome everyone. I hope you've had a lovely Monday. Welcome, and I hope you are getting ready for Easter. So it's going to be a short week, so that's lovely. But feel free to start to drop your questions, whether you're watching on Instagram, on Facebook group, Facebook page, or you're watching on YouTube channel. Just drop your questions. I think, am I done with all the pinning? I think I'm done with all the pinning here. Okay. So Instagram, okay. Hello Doc, hello Violet. Thank you so much for joining us. Thank you, Laurie Tamal, Nora BK. Thank you so much for joining us. All right, and on Facebook, I can't see any comment yet. Okay, but okay, I think I'm done with all the sharing and all the pinning. Apologies, I'm a little bit dark here. I don't have my lights with me. But feel free to start to drop your questions and then we'll try and answer them in the next 1 hour that we have. But remember that if you have any questions after the live session, okay, that's a little bit better. If you have any questions after the live session, you can always go to our Facebook group and you can ask your questions there. We answer questions from Mondays to Saturdays on our groups. So you are welcome to post your questions from Monday to Saturdays. If you are watching the recorded version of this video, so in other words, you're not watching on a Monday, you're not watching on the Monday at 6 p.m. West African time. Most likely, you are watching the recorded version after the live session. So if you have any questions after watching the video, please, you have to go to the Facebook group and you can post your questions there and we will try and answer your questions from Mondays to Saturday. You are not able to post questions on our group a on Sundays because we are not always there on Sundays, but Mondays to Saturdays, 24 hours every day, we are there to post to answer any questions that you may have about the health of your children. Remember that you can also read a lot about some of these topics. If you want to read more in details, always go to our website www.actpediatricians.com, or you can watch our podcasts. We have teachings on the podcast. There's virtually I doubt if there's virtually any topic that we have not covered now. Somebody was asking on our group the other day, Doctor, please can you talk about chicken balls? I'm like, we've talked about chicken balls many times. So I just sent her the links. So so when people ask questions like talk about this, they don't realize that we've talked about it before. We've talked about autism hundreds of times. We talk about it every year. There are some topics that are like a yearly event. We talk about autism, breastfeeding, during breastfeeding week, autism during autism month and week like April. So we've talked about so many of this topic quite a lot already. So feel free to always go to our Facebook, our website, our YouTube channel, or our podcast, and you can always watch and you can always listen to some of these teachings. And if you like to read instead, you can go to our website. There are loads of articles on our website on topics that have to do with health of children, and we answer them. I think people ask me questions a lot about OCA and all those kind of things, and is I think the most read topic on that website. So feel free to check out all these resources that we have. Okay, I think I have my first question from Violet. Please, at what week or day am I to take my baby for the 6 weeks immunization? Is it a day after 6 week or the 6 week? Okay, very good question. Ideally, your baby should be immunized on the day the baby is exactly 6 weeks old. So they're exactly the same day. But in the real world, it doesn't always happen that because most of these health centers or hospitals, they give certain immunization on certain days. So there are hospitals, health centers that give immunization every day. For those ones, if you go on the day your baby is exactly 6 weeks, they will give the immunization. But some of them don't do that. So they may have maybe it's a Tuesday or it's a Thursday, whatever day they give immunization. So as long as your baby is 6 weeks, any day after that 6 weeks, if it's that week itself, the whichever day they give immunization, you can go and get it. I think the 6 week immunization is straightforward one because it's usually single doses, so that one is easier to give. So most likely, if it's a health center where they give immunization every day, so any day you go, as your baby is exactly 6 weeks, they will give that immunization. But there are vaccines that they don't give every day. In fact, there are vaccines they don't give every week. So we call them multi-dose vaccines. So like BCG, yellow fever, these are vaccines that they come as multiple doses in one bottle. And once we open one bottle, we have to finish it. So it is a waste to open it for every baby that comes up. So what they do for those kind of vaccines is that we pull the baby. So usually they do it once a month. So they may say, okay, BCG is always the last Thursday. If you're lucky and your baby was born on that Thursday, then your baby is going to get BCG on the same day the baby was born. But some babies will not get it until the last Thursday. If your baby was born on the first day of the week of the month, then the baby will have to wait until maybe is almost a month old on the last Thursday, because it has to be shared. So once they open one bottle, they have to finish it. They have to use it for all the babies. So it makes sense for them to pull the babies together before giving the vaccine. So BCG, I think yellow fever and measles, those are the ones that tends to be pulled. I think measles, not yellow fever, measles and BCG. But most of the other vaccines, they are just one dose for each child. So they can give it anytime. But so just find out what they do in your health centers, and then they will give it to you. But the most important thing is that you take your immunization on or after. So you cannot take it before your baby is exactly 6 weeks old. You can only take it after your baby is 6 weeks old. So you can take it on the day your baby is 6 weeks, or as soon as possible afterwards. So I hope that is clear, Violet. Thank you for asking that question, and thank you for taking your baby for immunization. Is very, very, very important that our children are immunized to protect them against these dangerous vaccine preventable diseases. We are beginning to have outbreaks of diphtheria, outbreaks of which we shouldn't be having. And the reason why we're having them is that because people are beginning to relax and thinking, and we're having a lot of people say a lot of nonsense on social media about why you should not take your children for immunizations. But that is why we're not having outbreaks of measles, even in places like UK and Europe. We're having outbreak of diphtheria in Nigeria because people are not immunizing their children. So, and children are dying from it. So it is very important that we take our children for immunization so that they can be protected against these very dangerous killer diseases. All right. Thank you. Okay, Violet is still asking, your baby is just 5 weeks old and has rashes on his face or neck. What is the cause? Violet, I have to be a superhuman to know what rash your baby have without seeing your child and to know the cause. So it's virtually impossible. Okay, so we pediatricians are not superhumans. We are not diviners. We don't just know things just because you say your baby has a rash on the face. So we have to see the rash first. Okay, so without seeing the rash, I won't know what rash your baby have. That is number one. So for this kind of question, because on a platform like this, you wouldn't be able to post a picture, so you can go to our Facebook group, take a picture of the rash. Please, when you're taking pictures, take a picture in a way that we will know the parts of the body that is affected. Don't take pictures of only the side of the neck or something. Facebook is AI is becoming so crazy. Anything that is not clear is going to be flagged as nudity, and when it is flagged as nudity, we get penalized for that, and our group is at risk. So please post a picture. When I see it, I will know this is the face or this is the neck. I know clearly which part of the body it is. So you can, if you don't want to show your child's face, that's fine. But at least just post it. Just take enough picture that will help us know the part of the body and also see the rashes clearly. We don't need blurry pictures, it's useless. So if you look at the picture, we can tell you whether, oh, this is itch rash, oh, this is melia, this is an infection. So we'll be able to advise you further. And when you post those kind of pictures, please also tell us something about the rashes, how long it has been there. Is it only on that, which part of the body is affected? Any other symptom? Is it itchy or not itchy? Is it bringing out little water like pus or not? All this information are very important. Some people always like to post pictures and then they just tell us what is that and what is the solution. We are not able to do that. Okay, we need information. Doctors are basically detectives, so you tell us some things and that will help us to narrow it down. Oh, based on this information and the way the rash look, it is like this. Based on this, is like that. And sometimes we are not even always 100% sure. Yeah, we can say that. Sometimes we think, okay, most likely is this, let's try this. And it is not every rash that requires treatment. Some rashes don't require any treatment, so which is why we need to see rashes first. And please don't take advice from people telling you, go and use this, go and use that. Everything rash, go and use that. No, don't take advice from such people. For example, your child may be having rashes as a reaction to the products that you are using on the baby's skin, for example. So if that is the case, then all we need to do is to tell you to stop that product, and that is it. Or your child may be having rashes as a result of eat rashes. A lot of babies tend to have eat rashes, and most of the time what we need to do is to just tell you, please reduce the covering, make your room ventilated, let it be cool. There's no law against using AC or fan for newborn babies, like Nigerian mothers always assume. So, and that is all that we need to clear the rashes. We don't even need to do anything. So there are some rashes that are normal in babies. Well, like they're not big deal. Like Milia babies tend to have all these white dots all over their face when they're born. We don't do anything about it because it's going to clear. So it is not every rash that we have to do something about it. You don't have to always clear everything. Okay. So sometimes knowing when to leave things alone, it's also important. I know mothers always want to do something about everything, but we don't always do that as pediatricians. Some things just let it will come to pass. You know, when the Bible says it will come to pass, we like that a lot in pediatrics. Some things you just leave it and it will come to pass. You don't need to do anything. All right. So, well, let's post the picture and we can advise you further. And sometimes we are still not sure even from picture, and we want to see you, we want to see the baby, we want to examine the baby physically. So in that case, we'll tell you you need to go to the hospital. So I hope that's helpful. Facebook people ask questions. I can only see question on Instagram, but let me continue. Miss Fumi, good evening, long time, nice to see you. Okay, Violet, thank you, you're welcome. Ms. Fumi says multivitamin really necessary for babies. I'm sure I must have answered this question, Ms. Fumi. Say, oh, because you are a very consistent and constant member. Okay, the short answer is no. We don't need to give babies multivitamins. Truly, 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 for us as pediatricians, your baby does not need to take any drug. Nothing, no drug. I know a lot of mothers always ask us, what drug should I be giving to my baby? Your baby needs no drug, zero drug, nothing. Okay. So what is multivitamins? Vitamins are what we call, they are a class of food, yeah, that children needs, but in very small quantities, and they help with some processes in the body, what we call metabolic processes. If your child is eating well, they are going to eat all the vitamins they need. So, for example, your vitamin C is in all your citrus fruits, your oranges, your tangerine, and all those lemon, whatever. Your child is playing, going out in the daylight, they'll get a lot of vitamin D from that. Your child is eating carrots and eating vegetables, they're going to get the vitamin A, the vitamin B. Palm oil also have vitamin A. So if your child which is why we say eat variety of food. Don't just give the children rice only or pap and milk only. If your children are eating all the food from the different food classes, and eating fruits and eating vegetables, they're going to get all the vitamins, and it is easier and better for your children to eat their vitamins rather than to take them as tablets. So we don't want you to give children multivitamins. We want you to let them eat well. Of course, there are some children that mothers will say, "Oh, my child doesn't take fruits, doesn't take vegetables." Da, 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 da. So, okay, yes, fine. If your children is not taking fruit and veggies, we may want to make sure the child, because vitamin deficiency is a serious disease. So if your child is, like, for example, vitamin, why do you think we give our babies, we give vitamin A? Because vitamin A is the single most preventable cause of blindness. You can imagine a child going blind just because they don't take vitamin A. That is why we give all the babies vitamin A now. I mean, no baby should be going blind for something that just a drop of oil in their mouth take care of. So because of that, the government took it upon themselves. We just give all the children vitamin A every 6 months. And luckily, vitamin A is one of the fat soluble vitamins. If you remember your biology in secondary school, so vitamin A is fat soluble. So in other words, when we give a little, it stores in the body. It doesn't get washed out, and all your baby needs for the next 6 months, that drop is enough. It will take care of it. Then after that, we give another drop. But also, most of the food that we give our children, our sugar, our butter, we try to tell the manufacturers to add a little bit of vitamin A to them. So for those people that even miss out on taking the vitamin A in their centers, if they are eating, food, their mothers are making them pancakes from flour, from sugar, from milk, all the vitamin A's have been added. So you will see a logo of I If you see a logo of high on a product, it means vitamin A has been added. So that is what we try to do. So we try to fortify food as well with these vitamins. So, but if your children are eating well, they don't need to take multivitamins because all the vitamins they need, they will get it from the food. And you don't really need vitamins in large quantity, So even the child just taking one piece of orange or apple or whatever, they are getting a lot of vitamins from that. Or having a little bit of veggies in their food, they are getting a lot of vitamins. So as long as we are not giving our children just carbohydrates and just things, things that don't have also all variety. Even some of these carbohydrates, they have a little bit of vitamins in them, but it's not as much as the fruits and the veggies will have in them. So which is why it's important to always add different groups of food together and not just sticking to one all the time. So summary, is for me, your child does not need to take any multivitamins as long as they are eating well. Unless you're sure your child is not eating well, and then if your doctor sometimes will say, okay, give them multivitamins at least while we're working on them eating well, then that's something that's you can do. So some doctors will prescribe it for usually for children who are not eating well, who are falsy, another but make or if the child already has vitamin deficiency. So if the child is already vitamin deficient, of course, we have to treat. And that treatment is by giving vitamins. So some children have vitamin C deficiency. They have what we call scurvy. Their gums are bleeding and all that we have to treat. Like I said, when children have vitamin E deficiency, they can go blind. When children have vitamin D deficiency, they can have rickets. So there are diseases that are attached to vitamin deficiency. So we don't want children to have those diseases. So option one is for them to eat all the vitamins. Option two is for them to give them the vitamin supplement. But the best option is for them to eat the vitamins rather than for them to take them as drugs. Okay, good evening, Facebook people. Good evening. I can see all your greetings. Thank you so much for joining us. But please ask questions. I can't see any questions on Facebook. Let me go to the group. I hope nobody is dropping questions in the group. Please, if you're in the group, if you're watching on the group, please make sure you click on the video to drop your questions. If you don't click on the video, and you just drop your questions, I will not see it in my studio here. But if you click on the video, then I will see your question in my studio, and then I can answer them. But Instagram people, I can see your own questions, and if you're on YouTube, just drop your questions. I can see them clearly. All right. Okay, I have a question from Facebook finally. What is the best way to manage colic in babies? Okay, thank you, Cynthia. That's a lovely question. Colic or infertile colic, like we like to call it, is one of those common conditions in babies. Number one, let's of all know what colic is because a lot of people classify everything as colic. I think somebody was saying something the other day that my baby is vomiting and that is colic. No, colic is not vomiting. Colic is not diarrhea. Colic is it's not even abdominal pain. Lots of mothers, oh, my baby is having abdominal pain because they are turning and twisting. That is not really abdominal pain and it's not colic. But in colic, babies basically just cry. You see a well, healthy newborn baby crying for hours for absolutely no reason. You fed them, they are not wet, they are not hot, they are not cold. They just cry, and it's very try. It's a trying time for mothers because they figured out everything, they've ruled out everything. That the child is otherwise well, the child is otherwise fine, but when they get to a certain time of the day, they just cry. We usually say rules of three. They may cry for up to 3 hours in maybe 3 days for 3 weeks, and you don't worry about all those ones. But basically, a baby who is crying and there's no reason. We're not really sure why babies have colic. We think sometimes it may be due to the lot of gas because we notice that when they are doing some babies, too much gas in their tummy, they're uncomfortable, makes them cry, and there are a lot of theories, but you don't need to worry yourself about that. Basically, this is a baby who is crying, and there's for absolutely no reason for that. So, what do we do? How do we manage colic? The truth of the matter is that most babies have colic is a passing phase. Again, it's one of those, it shall come to pass. All right. But what can we do is try to make the child comfortable. Different things work for different children. Most of them, just some, that's why African mothers, they back their babies. Sometimes the baby, that backing, that's pressing on the baby's tummy help them. Some babies you don't need to back them, even just rubbing their tummy or rubbing their legs, it helps. Some babies like white noises. If you put on your maybe a fan or washing machine, or these days you have all those noises on your harp. You can, those, some babies like that. Some babies like for you to run around with them. So some people put babies in the car and drive. That motion also helps some babies. Sometimes we try for babies that have too much of gas in their tummy. Sometimes we give them samexicon, which is what do they call it now? Um, Infacol, yeah, Infacol. So sometimes it helps, sometimes it doesn't help. Like I said, different thing happens for different babies. But the good news is that most babies will stop crying. So for mothers, I think the issue is that mothers are the one that are more frustrated with babies crying. There's nothing wrong with the babies. Babies crying is not bothering the baby themselves. But newborn moms, they are very tired. Please get help. It's okay for you to take a break, go and sleep, let the father take over, or grandma. That's why Omugwa is lovely. At least you have somebody else to take over, and just give yourself a break. Don't like, because some mothers have postpartum blues and they have um postpartum depression, and colic tends to make it more difficult for such mothers. So for such mothers, just take a break, okay? But the good news is that by the age of 3 months, most babies stop having colic. Most babies don't have any colic anymore, and they're fine. So another thing that I tend to, I would say, when you breastfeed your baby, try to avoid them crying too much or sucking a lot of gas before you attend to them. Be very attentive to your baby's cues, because babies that cry a lot and sucking a lot of gas, the gas also has to be passed out, and that process of getting rid of the gas in the tummy, either through flatulence or through burping and belching, it also makes the children babies uncomfortable, because the babies are also just getting used to their body. Everything surprises them. They pass gas, they are surprised. They pass urine, they are surprised. They pass to, and so they react to everything. And then sometimes they react by crying. But the good news is, as they get older, they're also more comfortable in their skin, in their body, and they're fine. So colic is a passing thing. It's more of just make the baby maybe baby comfortable. Do what you can to make baby comfortable. If it's really bad, because sometimes babies have other issues and it's not colic, and mothers just assume colic, please stop and see us. Come and see the pediatricians, and we'll take it. We'll sort it out. All right. So I hope that's helpful for Cynthia. Okay. All right. Let's move on. If you have more questions, feel free to add it. I will respond. Chidima, Jennifer, my son of a month, 3 weeks, have cough and catarrh, and he has lost his voice. Yeah, I hardly hear when he cries. He must have really cried so much that he lost his voice. So yeah, sorry, baby. He doesn't breathe fast. What can I do? If most children having cough and catarrh is usually an infection, what we call upper respiratory tract infection, and they're usually caused by viruses. Basically, we don't do anything about it. I think I'm saying a lot of we don't do anything today, and I think a lot of mothers may not be happy with that, because mothers always like to do something. But the truth of the matter is that sometimes not doing anything is the best thing to be done at some point. So most children who have cough and catarrh, they just have a viral infection, which they get from people, which is why I always say, knew the mother that people are coming to visit. So please keep the baby away from the visitors, because babies are still developing their immunity. They are still developing immune system. So they don't have capacity to fight all this infection that all these people coming to say they are greeting babies are coming. And most of us, everybody who comes and the viruses into the newborn baby. So because babies will not have any catarrh and cough if they don't get exposed, and they get exposed from people, either their siblings or other people, adults coughing, having catarrh. And some of them may not really be that sick, but they can still transmit the germs to the baby. So please keep baby away from people. You can go greet your visitors and let the baby stay in the room. honestly. And then you make sure your baby is breastfeeding exclusively, because one of the things you do through breast milk, which is what we try to let parents know, is that breastfeeding is not just about feeding. All the other things you give your baby, like formula, they're only going to give your baby food. They will not give your baby protection against germs and infection, which is what breast milk does. So you, as the mother, you have had cough and catarrh, you already had a lot of infection in the past, and you already develop immunity. You already have all these antibodies that protects you. When you breastfeed your baby, you're actually passing those protections to your baby. That is why breastfeeding is so important. It protects your baby against those germs and infections. So we recommend you breastfeed your baby exclusively, not just breast milk and formula, breast milk only. So your baby gets a lot of antibodies, protection against germs. So, but the good news is that most viral infection, they will run their course, and within 2 weeks, the baby should be fine. I like the fact that you already said the baby is not having fever, the baby is not breathing fast. Did you talk about fever? You didn't talk about fever, but okay. Anyway, if your baby is having fever, or your baby is breathing fast or having difficulty with breathing, you need to take the child to the hospital. This, your baby losing voice, that's, we tend to get that when the baby has cried too much and nobody, responded. It's very rare for them to lose their voice just from cough and catarrh. Most time it's from crying. Anyway, but just watch it. If the voice doesn't come back, please see us as well, and just be sure there's nothing else going on. But the cough and catarrh itself will usually go away, and keep your baby warm, keep your baby away from people who have cough and catarrh, keep your baby from people who have visitors. Even you yourself as a mother, wash your hands. Everybody touching baby, wash their hands. Remember what we do during COVID? That is how to protect and prevent respiratory infections. You wash your hands, you don't sneeze into baby, you don't give baby to people, you maintain some, let people keep away from the newborn. Avoid cooking or taking baby to the kitchen. Don't cook in the room. Don't take baby to the kitchen or to where the cooking is, frying oil. Avoid all these perfumes and sprays. They irritate the baby's airway. When the baby's airway is irritated, it make it easier for them to, for the viruses to take a foothold and cause respiratory infection. So those are simple things you can do to prevent respiratory infections, and but the infection itself will run its course. But if there's fever, there's fast breathing, there's difficulty with breathing, that may be a bacterial infection, and that needs antibiotics. That has to go to the hospital. So I hope that's helpful, Chidima. Thank you. If you have any further clarification on the question I've answered, feel free to ask again, and I will try and answer them. Thank you. Just to also remind us, this is still Autism Week, Autism Month, actually. The whole of April is Autism Awareness, and I think we are promoting autism acceptance. So while I'm waiting for more questions, I will just be chipping in a little bit about autism. Okay, somebody asked a question. Does taking soft drink cause inla? I guess when you say inla, you mean skin rashes. Please, when you ask question on this platform, try and put it in everyday word. Avoid local language description, because they mean different things to different people. I know what you meant, because I know people use inla in Igbo language to refer to some skin rashes. People will use ela in Yoruba language and all that. The challenge with local parlance or local explanation or terminology, I don't want to call it diagnosis, is that they don't always match. They don't always have the medical equivalents. Okay, let me put it this way: there are different things people will call. For example, let me use ela. For example, people say, "Oh, every rash, ela." There are different kind of rashes that, but people tend to lump them together, and they are not the same. They are not the same. So for us as pediatricians, we prefer you describe the rash. Tell us where the rash is. Tell us, is it like color changes, like the part of the skin is lighter than the other part, or is there something like a bump, like a raise, and that bump, is it something solid that you can feel, or is it something you can see, and is this something that has water inside, or is this something that has no water inside? Is this something that, what kind of water is inside? Is it clear water, like when you know what you get in eat rashes, or is this something like yellowish water, which is what you get in in like pulse, like in bacterial infection. So it's better that way. That's why most time when people ask questions, we just say send us a picture, because a picture is worth 1,000 words sometimes. Unfortunately, on live session like this, we can't take pictures. Anyway, but back to your question. Well, I think I've gone off track a bit. Soft drink does not cause any rashes unless your child is allergic to something in the soft drink, and well, I will assume that you should have the rashes because you are the one drinking the soft drink and not the baby. So if you're, I've hardly seen anybody who is allergic to soft drink, to be honest. But it's not impossible. People can be allergic to anything. There are people that are allergic to water. So or even just the temperature of water, hot water they will be fine, cold water they have rashes, or cold water they are fine, hot water they have rashes. So people can be allergic to anything and everything. So if your child is not allergic to soft drink, your baby should not have skin rashes. Okay, so I doubt seriously that your baby having skin rashes has to do with your soft drink. Of course, I don't want you to be taking too much of soft drink as a mom. I think you should drink more of water or natural fruit juice you extract in your own kitchen, but I don't think soft drink is what is causing skin rashes in babies. There are many reasons why babies have rashes. Let me tell you the common ones. The most common reason why baby have rashes is the product that you're using on the baby's skin. Babies have very sensitive, very tender skin, and most of us go and buy all these lovely products that these mothers and babies shop they sell to us. They all look like nice smelling and all that kind of products. Most of those products are actually dangerous for the baby's skin, because all those things that are smelling nice in them, they are chemicals. And those chemicals, the baby's skin are very sensitive to them. Most time you get away with babies that don't have sensitive skin, but some babies are very sensitive in the skin. So you put all these chemicals on the skin, they're going to come out with rashes. So we always tell mothers, please use natural products. Avoid, I know the urea and all those other coconut oil, shea butter, they don't smell so nice, but they are the best for your baby's skin. Even just petroleum jelly, the Vaseline without any perfume. So or oil, olive oil, coconut oil, they are the best for your baby's skin. Stay away from all these named, all the names of them, them, that they always sell in the shops for you. And they will sell it. There's a lotion, there's a oil, there's a soap, there's a powder. All those things are not good for baby skin. You just stay away from them. That's the truth. So unfortunately, I think people that sell those products, they do a lot of advertisements, so mothers fall in love with them. But really, they are not good for baby skin. That's number one. Number two, stay away from all this antiseptic soap, all these even all these so-called antiseptics that we have to babies' water, unless you are sure your water is not good. And then even then the dermatologists recommend you use things like what's it called, all these things they use to purify water, purites or whatever, all those like chlorine, like bleaches that they use to purify water. They prefer you purify your water and then use it to bath your baby rather than use all those antiseptics. So babies are sensitive to them. So avoid all those things, okay? No, those are the commonest reason for babies having rashes. Then we put a lot of powder on the baby's skin. Babies don't need powder on their skin. They need their skin to be well moisturized. They need water on their skin. All right. So you should stop using powder, because powder dry up the skin of the babies and then it will itch them, then they're going to have rashes. And if they are not also reacting to the chemicals in the powder and that make it smell nice. So use moisturizer, natural ones, Vaseline Blue Seal, shea butter without any perfume, coconut oil without any perfume, olive oil without any. Those are good things to use on your baby. Use the black soap if you like. It's okay. The natural black soap, not the one that they've add perfume and everything. Or use normal toilet soap. As much as possible, avoid the one that have too much of perfume chemicals. Or if you go for some product like Sebamed that have been dermatologically tested and customized to be good for people with sensitive skin. I think Dove as well. Those ones you can use them, but most of the everyday ones that people sell in the shops, they are heavily loaded with chemicals and they make babies to have skin rashes. So that's number one. Number two, people's hands. That is where baby gets all those rashes from. Before, people, everybody just carrying baby with their hands, not washing, and the hand they used to touch everything, full of germs. If you put it under microscope, you see so much germs on people's hand. That's why during the COVID, you remember, wash your hands every for 20 seconds and all that. Before anybody touch baby, they should wash their hands. And I know people, it's our culture that people just come, where's the baby? Bam, they carry the baby. And most time mothers are very reluctant to tell them, please wash your hands or please use hand sanitizer. Please, you should be more consist asked for people to go and wash their hands. Even myself as a pediatrician, I go to people's house to visit them. I don't ask to carry the baby. But people always want me to carry the baby because I'm a pediatrician. So I'll tell them, give me hand sanitizer or let me go and wash my hands. Seriously, that is how it should be. So it's as much as possible when you go visit people, don't carry their babies. Yeah, don't carry their babies. If you want to carry the baby, go and wash your hands. It's better, don't carry them. It doesn't mean that you don't like the baby, but don't touch them. Most of you are just, because all those dirty hands, we are just putting germs on the baby's body. Then sometimes mothers too, we just put our baby on all this, our chair, our sofas, in the living room, you're watching your TV, then you just put the baby on the sofa. Some of those surfaces are contaminated with spores and germs. So I always tell mothers, before you put baby on anything, put the baby's own stuff that you have washed regularly. Most time we wash baby stuff almost every day. At least we are good with that one. So please put the baby's blanket or mat or anything first before you put the baby on surfaces. Otherwise, you're going to put the baby on surfaces that have been contaminated with germs. Baby skins are still very sensitive, very tender. So we really need to pay attention to all these little things. When we do that, even the soap, some babies are also sensitive to the soap that you're using to wash the clothes, the detergent. So when you use detergent to wash baby's clothes, you should rinse it very well. And please don't use too much soap. Most of those clothes are not dirty anyway. Baby is not going out. They didn't roll in dust or mud or anything. It's just maybe the reflux on it or the pee on it or whatever. Just soak them, put little detergent, wash and rinse very well. Rinse it 2-3 times. I'm serious, because sometimes those little detergent that are left on this clothes, they irritate the baby's skin and baby will have rashes as well. So you want to rinse it very well, and if possible, use some soap that are also sensitive, what we call hypoallergenic. Use them. There are some of them in the shops, so you use them and rinse it thoroughly. Rinse the baby's clothes multiple times. Get rid of all the soap in it, and then please dry it very well. Please iron it if possible. That is the best. That the ironing also kill the germs on those clothes. That is the point. So these are little things that we can do to stop our baby from having rashes. So that is the number. The next one is babies are also they can have allergies to many things. And for those of us who like to formula feed our babies, sometimes babies are actually reacting to the formulas we are giving them, and that's why they're having rashes as well. So, which is why we say breastfeed your babies. Just breastfeed. Your baby is very unlikely to react to your breast milk because it's you and the babies, you tend to share the same gene. So, very unlikely for your baby to be allergic to what you are not allergic to. And then please be careful of the drugs and all those. I know a lot of us feel like new moms, they must take a lot of spices and flavors. Some babies are sensitive to those things. It makes them also very colicky as well. So please take as much as possible plain food. Don't take too much of heavily spiced. I mean, all some of these pepper soup that people prepare that they've added too many things. Some of those spices, babies are they are intolerant of them if they are not frankly allergic to them. So don't take. Also, be careful the drugs you take. Before you take drug as a breastfeeding mother, please let your doctors know that you're breastfeeding, because your drugs can go into your breast milk. So they have to be mindful of what they prescribe. So these are some of the things that we don't think about that can give our baby rashes. So sometimes just taking care of some of these things, 90% of the baby's rashes are gone. I'm telling you the truth. Once in a while, some babies have some skin condition. So some babies will have some rashes from some skin condition, but those are the very few of them. There are not many, but most of the other rashes, they are all these things I've talked about. The wrong products we're using on them, the dirty hands we're using to touch the baby, the detergents in our baby's clothes that we're not rinsing off thoroughly, all the powder we're putting on babies, all the antiseptics we are putting in. Those are the things that the baby's skin is, or even the product, the drugs, the formula that babies could be allergic to. If we get rid of all these things, then our babies we'll be fine. So I think I've gone overboard on that, but it's a very popular question that people ask a lot, and I think I just need to address it in details. Of course, we've talked about it before. If you go to our Facebook, if you go to our website, there's a article there, and a lot of you have read the article and always say, "Oh, thank you for that article. It's very lovely." It was delivered by one of our dermatologists, so it's something from the the experts. So I hope you've learned from that. Okay, Bolanle Hololade. Good evening, ma. Is it advisable to cut your baby's 3 months old baby's boy hair? Okay. Um, Cutting your baby's hair is a parent's decision. It has nothing to do. It has no medical thing. And the kind of question people ask pediatricians sometimes. So cutting your baby's hair is your decision. There are people like our Islamic faith members. They cut the baby's hair from day one. Day eight rather. Sorry, eighth day of life. They scrape everything off, and babies are fine. So, and there are people that would never touch their babies until they are 1 year old. I think it's a personal thing, really. It's do what works for you. There's no medical implication, whichever, whether you cut or you don't cut. Our own is, child, don't make sure there are no rashes. Make sure you wash it, you shampoo every day, and you put a little bit of oil on the scalp just to moisturize the scalp. But you don't need to be putting oil per second like some of my Nigerian mothers. That's another thing I should have mentioned when causes of rashes. I forgot that part. This oil that people are always putting on baby's hair per second, you need to stop. It's very unnecessary. But what it does is that it drips down the baby's face, and that's how even the mother themselves, they have those rashes on their own skin because they keep putting their hand when they're carrying the baby. The oil is dripping on the mother's hand and it's irritating the mother. The mother too will have rashes, baby will have rashes. Too much oil on the baby's face. So let's stop it. Baby, the anterior fontanelle does not need to be to have oil on it. Like one of my first time mothers said, it is not a shrine that you have to put oil on it per second. It's not. So once a day when you bath your baby, you've washed the shampoo, the hair, you just a little bit of oil just to moisturize the scalp. That is all for the day. You don't need to keep putting oil on it per second per second. It's okay because that oil drips down the face, irritate the baby's face, they itch it, and then you also come back with rashes. So as long as you're able to manage your baby's hair well, it is fine. Okay, if you think the hair is too much and you are struggling with combing, you are struggling with the tangling the hair and all that, please cut it. They don't collect money in bank because you have plenty hair. Of course, most people like the baby's hairy and all that, but it's actually your decision. It has no medical implication whatsoever. So it's just do whatever works for you. There's no problem with that. If you cut your baby's hair and the weather is cold, you can wear like a cap for them to keep them warm. But otherwise, there's no particular medical worries about that. All right, thank you to those who are just joining us. If you have any question, I think we still have about 20 minutes. 20 minutes. I think we actually have 12 minutes to go on the program. But if we are gone and you are just joining us and you have questions, not to worry, we got you. We got you covered. Go to Ask the Pediatricians Facebook group. You can post your questions on our group from Mondays to Saturdays. 24 hours of the day, and we will answer your question. Please be patient with us. Sometimes, depending on the kind of question you are asking, somebody else more senior have to answer the question. If you want a specialist to answer it, so be patient with us. But we try as much as possible to do all the questions within 72 hours. We rarely go beyond 72 hours. So please don't send your questions 4 or 5 times the same day. I mean, you are just going to waste our time reading it and disapprove. So please just send your questions once. Give us some time. 24, 48 hours, we will answer it. Most time, Facebook will notify you once your post has been approved. All the posts on our group are subject to approval. So the fact that you've not seen it does not mean it's not in the group. It's just like it has not been approved because we need to make sure, there are lots of people that post nonsense on the group. So we have to censor and take off those kind of nonsense. So that is why everything is subject to approval. Also, all the posts on our groups are answer from a pediatrician's perspective, okay? And we don't need people helping us to answer questions. Only the moderators and the professionals are allowed to ask answer questions, and the reason is very obvious. But unfortunately, some people will still come to the group and their members and they will just start to answer questions. Please don't. All right. It is ask the pediatrician. So if you are not a pediatrician, you already the group name is very explanatory. It's self-explanatory. It is ask the pediatrician. The people coming to our groups are not coming to ask fellow mothers. There are groups that do that, which is okay, but the what make us stand apart from every other Facebook group or platform is that you are only going to get a pediatrician perspective. Even our moderators are trained, they only give answers that a pediatrician or a professional has given before. They don't even give their own perspective of view. So even though they are helping us out, because obviously, I mean, there's no point answering the same question 100 times. How long should I breastfeed exclusive for 6 months? So when you ask those questions, our moderators help us to get the answer from the previous pediatrician answer and put it for you. Why? So that the pediatrician have time to answer the newer questions that have not been answered before, or things that are a little bit more complex. So that's why we have moderators. But trust me, the moderators don't answer according to their own view. They only copy what a pediatrician or professional has said before, and they will always give you a reference for you to check it out for, so you know it is from a pediatrician. So our group is distinct in that perspective. So whatever you get from us, you can take it to the bank because that is a pediatrician's opinion. We're not saying the pediatrician knows everything, but we just want you to have a pediatrician's opinion, whether you agree with it or not. That is now your own decision, but at least we want you to trust that this is what a pediatrician would say in this scenario, but you have a freedom of choice of what you do with that information. Our own role is to share the information with you. So please, if you come to our group, don't answer questions, and that's why we close our comments. A lot of people still keep asking us, why am I not able to comment on this group? Why am I no, you are not meant to comment on the group. The group is for you to ask your questions from the pediatricians and to get answers. You are not there to come and share your experience and all that. A lot of people try to do that, but we don't allow. So for those who may wonder why, that is now the answers. Okay, because I always get that questions all the time. All right, BB catering and events. Okay, so my baby started solid. How old are your babies? Always start every question with the age of your child. All right, that is very important. The pediatrician cannot answer a question when not knowing the age of the child. It is as basic and as important as anything you want to tell us, because we need to know what category of people we're dealing with. All right. So BBC, you have to tell us the age of your baby. Okay, they are 6 months old. Lovely. The poo is that. What are you feeding them? Okay, so when you start complementary feeding, your children should be sticky breastfeeding. Okay, and then you now start to add um solids. So if you are not on because BBC, you're on BB catering. Sorry, I started calling you BBC. All right. If you are not on our Facebook group, I would say go to our Facebook group so you can go through the guide section on complementary feeding. So it is important for us to know that complementary feeding is not replacement feeding. It is not weaning the baby. The baby should still be taking as much breast milk as they're taking before you start to give them solid. And now you are just adding the solid. But sometimes some others, I think we are enthusiastic to just say, oh, I'm done with this breastfeeding. Let me now put baby on the other solid. No, please keep breastfeeding and then you give them the solid. Now, when you give them the solid, the texture matters. So usually when you start, we want you to give them something soft and something, like mash or porridge like at 6 months. And a 6 month old, they should only have 2 feet of complementary feeding. 80% of their food is still breastfeeding, and it's just 2 meals in a 24-hour period that should be complementary feeds. And it should not be more than 50 meals in total. I mean, that is, each meal should not be more than 50 meals. So make sure you're doing the right thing first. That is what I would say, baby catering. Make sure you're doing the right thing first. in terms of how you're feeding your baby, the quantity you're giving them. Of course, you should give plain water as well. And when you're giving your baby food, please don't just give them only cereal. It's not just with pap and milk only. The children need to take, you should be adding some fruits and some veggies to it as well. So remember, they should have a little bit of snack, and usually that can be a fruit and veggies. So if you are really breastfeeding your babies, in addition to the complementary that you are just adding and also giving them water, they will not be constipated. So constipation usually comes from giving them something that is too concentrated, and we're not giving them water, and we're not breastfeeding, then they are prone to getting so. And please, let me start by saying, or let me continue by saying that formula feeding is not complementary feeding. A lot of people think when we say it is time to start complementary feeding, it means you should go and buy a formula in the shop. You don't ever have to buy formula even for complementary feeding. Your breast milk is still the milk that the baby needs. Baby don't need no formula. They just need your breast milk and other food, which can be all the food you have in your own kitchen, your rice, your maize, your porridge, your potato, your whatever, all those things. And then you're adding a little bit of fruits here, a little bit of vegetables here, and all that. So you don't ever need to go to any shop. Your kitchen and your breast milk is all the baby needs to have complementary feeds. So I hope that's helpful. But if you are doing all the right things and your baby is still constipated, please see us in the hospital, because we need to know why, and we need to treat the constipation. But most times we are doing the right things, the babies will not be constipated. All right, my time is going. Let me quickly finish the remaining questions. Bolanle said, what can make a baby reject breast milk from the mother? That's a very wide question. Most babies don't reject breast milk. Most babies don't. Most of the time, the so-called rejection of breast milk is due to poor breastfeeding practices by mothers. This is why, breastfeeding is something we need to teach mothers how to do it, because it doesn't come naturally. It is a science, it's an art. Mothers need to learn how to breastfeed their babies. So we always recommend go to the breastfeeding guide. We have about 6 or 7 breastfeeding videos. We always want mothers to watch those breastfeeding videos, and it's best to watch it when you're pregnant before you actually have your baby. Number one, breastfeeding must be established within the first 1 hour of life, within the first 60 minutes. So all this one, we will watch baby and carry baby somewhere and be giving baby water, giving glucose, giving formula. We shouldn't be doing it. Baby should be put to the breast within the first hour, even before the baby is washed. They don't need to be washed, they should just be put to breast, seriously speaking. All right, and mothers need to offer the baby breast as often as possible. That's what we call breastfeeding on demand. And you need to make sure your baby is attached well to the breast. Breastfeeding is 90% attachment. This is where mothers don't get it. They put baby to the nipples. Nipple is not what baby should be sucking. Baby needs to suck on the areola. So attachment of the baby to the breast is so crucial. If baby is not well attached to the breast, baby will bite your nipple. You'll be feeling pain. Baby is not getting breast milk. Everybody is frustrated. Baby does not want to suck. And then you start saying, oh, my baby is not sucking. Let me go and buy formula. Again, confusion. That is nipple confusion, because once you introduce bottle, you introduce formula. Baby doesn't want breast milk anymore. Baby is going to go with the bottle. That is nipple confusion. So most of the issues around breastfeeding is poor practices, which is why we were having those days in the 80s and 90s. We have what we call the baby friendly hospital initiative. We have nurses, about midwives, who help mothers to embrace breastfeeding, who help them to establish proper breastfeeding in the first 1 or 2 weeks, so that mothers get it right. If you get it right, your baby will suck their breast. They will not reject breast milk. But when we create all this catalog of errors, and then we are formula feeding, we are bottle feeding, then the baby will go for the easier option. It's easier to suck from a bottle than to suck from the breast. It's less work. And most of the time, the teeth is, you make a big round hole there. So the milk is just rushing into the baby's mouth. Whereas when the baby wants to suck on the breast, baby have to suck. It's work. So that's why babies will go for the bottle and the formula. Then you say, oh, baby doesn't want to suck my breast anymore. So that is it. Then sometimes some of us, so when we start complementary feeding, we just want to, it's as if we are now free from breastfeeding. And then we give too much of the complementary feed. Baby doesn't even want to take breast milk at the moment. So maybe we'll now stop breastfeeding and say, oh, baby has stopped wean themselves. It's because we're giving too much of the solid and not the breast. You need to keep giving the baby the breast. You need to continue. It's a process, a demand and supply. It is only very few babies that will reject their mother's breast milk. Very, very few. That will be the exception. Majority of the time, when people say babies stop breastfeeding or doesn't want to take the breast, there is a problem with the breastfeeding technique. It is not the baby doesn't want to suck. Unless babies who are sick, who have neurological problems, maybe they didn't cry, they have some brain injury or brain damage. Yes, those are the babies that, because the sucking is a reflex from the brain. So some babies who have a brain injury or brain damage may not be able to suck another. But even then, we can see, encourage them. But otherwise, an average well healthy baby will suck their mother's breast if they are done properly. There's no way they will reject their mother's breast. So I hope that's helpful. So what I normally say, that if a baby is not sucking, please see the pediatrician before you start doing anything, which is the problem. When the issues arise, mothers don't come to the pediatrician. They try to solve this problem by themselves. If you have come to us, we will try and help you get back on that breastfeeding. But most mothers will just go and buy bottle and formula, and then the breast will dry up. And that is it. End of breastfeeding. And then by then they will come to us that my baby stop rejecting breast, and 1 month, 2 months has passed. There's nothing we can do anymore. We try to, but it's always hard. So please see her, see the pediatrician, see your nurses, midwives. We will always help you, to get back on breastfeeding, which is why we do breastfeeding week every August. We preach breastfeeding. We are very passionate about it. We want mothers to get it right. Okay, she say, what makes my baby to throw up while feeding? How old is your baby? Always start every question with the age of your baby. It is so important. Okay, your baby is 9 months and current weight none. Okay, there's no reason. So why is your baby just starting to vomit now? Is your baby vomiting before? Because your baby is 9 months old. So is it a new problem or is it an old problem? Because we need to know. Obviously, if your baby is 9 months old and your baby is not vomiting before, and baby now started to vomit, then you need to know what is going on. Unless you are telling me this baby has been vomiting since you gave birth to the baby, but I doubt in a 9 month old. So if it's something new, then there must be something wrong. Uh uh if your baby said it's hot, you need to know how hot it is, get a thermometer, measure it. How many quantity of soybean powder should I give her in each meal? You don't need to give baby soybean powder in each meal. No, that's not the idea. So, okay, you need to watch our complementary feeding videos so that you understand the concept of complementary feeding. We want your baby to get complementary feeding, but baby doesn't have to take soybean powder every meal. Does it mean that you only give your baby cereal and soy milk powder every meal? No. Your baby should eat variety of food. Your 9 months old should eat other food. Okay, and it is not everything that I need for you to add bean powder to it. Okay. So make sure so you need to also make sure you're not giving your baby the same food all the time. Maybe that's why baby wants to vomit, because baby is tired of it. So try and give variety of food and try and feed your baby with cup and a spoon. Okay. And make sure that the texture of the food. Some children, if the food is too lumpy at this age, they may not like it. So make sure it's a little bit mashed, soft, smooth, if possible, porridge, but thick porridge, not watery. So, and please give your child variety of food. So this child should be having other food. It shouldn't just be something like pap and something you're adding powder to. Not at all. You can, for example, if you make pap and you want to add soybean as a protein source, that is fine. But other times, please make potato, mash it, put some crayfish or put some titled fish and something there. Other time, even all this you swallow and all that. So give them all the other food. So your baby does not have to be eating something you have to add, because the way you ask that question, so I that's my assumption, suggests that you have to give it in each meal. So when you ask me question, I'm reading all the details of your question and I'm responding to that. So sometimes people ask questions, maybe that's not what they meant, but you remember that I'm not there in your house. I'm only responding to what you wrote. You wrote here now that how many quantities of soybean powder should I give in each meal? And I'm like, why do you have to even give it at all in each meal? You shouldn't give it in every meal. So if you can give it your porridge or whatever, it's fine. And there are other things you can add to your like even your porridge, your cereal. The other time you decided to put egg instead of soybean powder. It's just protein. The concept is understand that this is carbohydrate, this is protein, this is fat and oil, this is vitamins and minerals, so fruits and veggies, and then there's dairy and all that. So what we want you to do is to mix them together, but what you mix each time has to be different. So maybe for breakfast, for example, it is the pap is the carbohydrate. You decide to use the soybean powder, then you decide to use maybe you cut banana into it or one other fruits, and then you put a little bit of palm oil or whatever, you mix it together, you cook it very well, and that is lovely. Okay, for lunch you don't have to do that kind of combination. For lunch you may decide, okay, let me do maybe I boil what's it called, maybe yam, or maybe potato, sweet potato. This time around I'm going to use Titus fish as my protein. This time around I'll use a little bit of butter as my fat and oil. I'll put a little bit of salt, and maybe I'll cut in some peas, or I'll cut in some carrots into it. It's a different combination. That's the idea. But you are still doing the same food classes, but what you use for your breakfast is different from what you're using for lunch. Maybe for dinner, you say, okay, I'm going to use maybe amala or semo as my carbohydrate. I'm going to use a wedu or okra as my, that's a veggie. And then this time around, maybe I'm going to shred chicken. I'm going to, blend chicken into it. That's my protein. I don't give parents food timetable. I expect you to know what you eat, as by your culture, what you like. But the most important is to understand the concept of food classes. What is the carbohydrates? What is the protein? What is the fat and oil? And then you can always mix it up in different variety. Maybe another time it's going to be rice and beans cooked together. Different ways of mixing the same kind of food classes, but you are still doing, so that's the goal, is variety. We don't want you to be doing the same thing every day or the same kind of food. Children get bored easily with those things. So I would recommend that I'm happy your child is eating homemade food. Please, if you need more information about that, go to our Facebook group and you can watch all the it will give you more information about all these kind of things I'm talking about. And if there's a particular food that you see, all the food that your child is eating that the child tries to vomit, you may want to watch, and then make sure you're not overfeeding the baby, because sometimes we feed the children to the point that they're overfull. There's also there's a quantity we need to give children. It's not the same quantity you will give them if you are giving them milk. The quantity of complementary feeding is smaller. It's about like half a cup. When we say cup, we're talking about like the milk cup, or like half of it for a 6 month old. When they come like 9 months, become 3/4. Then when they become like 1 year, 2 years, they become a full cup. So that's giving you an idea of the quantity your child should be eating. Sometimes I think some of us try to give children too much, and then that's why they want to vomit it. So you can also make sure, also texture, if it's too lumpy and all that. Some children don't like that, then they want to vomit as well. But you may need to triage, trying to know which one. If you're not sure, you can see your pediatrician or your the dietitian. We will help you with all those other final details. No worry, your baby will be fine. Somebody say, good evening. I've been giving my baby enough water, but she stay up to 2 to 3 days before she defecates. How old is your baby? Eluana Hamangala. Always start with the age of your baby, and so that we will know what baby we're talking about. I'm not sure I got the age of your baby. Is your baby not supposed to be on breast milk? Because with the age I'm seeing now, sound like baby who is less than 6 months old. If your baby is less than 6 months old, your baby should be on breast milk, and you should not be giving water at all, and it's perfectly normal for babies on exclusive breastfeeding not to pass stools every day. Hello, and I hope you are still there. If you are still there, quickly let us know the age of your baby so I can answer your question. Oh, your baby is 9 months old. Okay, 9 months old. Yeah, baby should be taking water. But I'm worried about the weight of your baby. That weight, is that the current weight of the baby at 9 months? 6 kilos. That baby is on the weight, so you need to really see us. That is, baby should be weighing like 9 kilos at 9 months. So your baby should also be on other food. Are you giving? I can't, because all I see is water. What kind of food are you giving? Fruits? Are you giving vegetables? Giving things like green veggies, your way do your okra, those kind of things. Fruits, are you giving all that as well? It's not just the water. And then I'm actually worried more about the weight of your baby. A 9 kilo baby, and your baby was a very good weight. Your baby was born at 3 kilos. So your baby should be weighing like 9 kilos now. So this baby is weighing 6 kilos. That is just the double. Your baby is actually just double the birth weight, and that double of the birth weight is at 6 months. That's why actually I was thinking your baby is around 6 months, because that is when we expect baby to double. They double at 5 to 6 months. So your baby's weight is like that. We expected the baby to have at 5 to 6 months. So I'm worried about the weights. I'm not even worried about the constipation, but I'm worried more about the weights. So some of the information I've given before on the answer to the post I was answering for Ogechi about complementary feeding, please, it also applies to you. I want to make sure you're feeding your baby well. That's number one. Number two, I want you to go and recheck that baby's weight again. I don't know when this one was checked. Have your baby gone for the 9 months immunization? If the baby has gone for that 9 months immunization and this is when the weight was checked, then the doctor should have flagged it up, or the nurses should have flagged it to see a pediatrician or at least a doctor. I'm surprised nobody flagged that up. But if that weight is the weight at the 9 months immunization, please, you need to see a doctor, you need to see a pediatrician, because baby is underweight. And we worry when children are underweight because it's a risk for them. All right, my time is up. I need to go. Eluana, please, if you still have more questions about your baby, please ask on the Facebook group. Well, I'm really worried about your baby, so let me know the updates on your baby in our Facebook group. All right. Thank you so much, everyone. Have a wonderful evening and enjoy your Easter. There will be no ATP Live next week, Monday, because this is Easter Monday. So we'll be off, but we will meet you again next upper week. I mean, that is after the Easter anyway. I think that'll be somewhere around after the Easter holidays. So we'll see you then. Until then, have a wonderful, wonderful evening. And bye bye from me. Bye bye. Bye bye. Bye bye. Take care. Bye.